looking at the criticisms of psychoanalysis, and the non-empirical part has been severely criticized by many people, particularly those from CBT area, which is a very empirical area, where you do very empirical studies in CBT. Similarly, we had a very severe attack from Karl Popper. Do you recollect Karl Popper, the philosopher of science, who gave this dictum that to prove something, you should not only prove that it works, but you should prove that nothing else works. Which is to say that if you want to prove that this medicine cures malaria, you should not only prove that this medicine cures malaria, but you should also prove that no other medicine cures malaria except this, so that we may not have some hidden factor at work. So you not only prove that something works, but you disprove that no other factor is at work. And that kind of Popperian criteria, when you apply to psychoanalysis, it becomes very difficult to really put that kind of criteria and have a very rigorous science. So is it really a science? Is it an inexact science? Is it a craft? Is it an art? I think we have come to the area where we are between a craft and an inexact science, but we ambitiously call it an inexact science. But much of it is still metapsychology. Metapsychology means you don't observe it, but you deduce it from observation. So you observe that people have traumatic memories of childhood, and you deduce that because of traumatic memories, something is happening. And repeatedly when it happens, you create a theory out of it. So repeatedly when Oedipus makes an advent, repeatedly when the split open makes an advent, we make an inference out of repeated observations and create a theory. But the theory is not observed, it's a summary of what is observed. And what is observed can be interpreted differently. And there is no way to refute different interpretations and establish only one is correct. So when that is the situation of knowledge in an area, we call it broadly metapsychology. That it is more philosophical in nature rather than strict observation in an empirical sense. But it's also not philosophical in the sense that it's completely out of touch, like for example, philosophy of the mind, right, which can go in a completely esoteric way. It's not that away also. It's just one step inference from observations. So it is less esoteric than philosophy, but more non-empirical than science, somewhere in between. We call it metapsychology. People say it is a very narcissistic science, self-righteous, and the therapists have become a new priesthood who are preaching the world what ought to be done, as though we have been appointed as saviors of humanity, which is not true, right? We have as much problems as everyone else has. But this is true. I have seen, not now, but maybe even a decade earlier, people did used to behave as though they were the priesthood. And they were just completely closed and self-righteous, just would not listen to anything, any alternative opinion. It is ideologically left, right? That is true. It is ideologically on the extreme left, and because I am on the extreme right, I criticize the left as the leftovers. And of course, when the group knows that they are all on the left and I am on the right, they kick me out of the group. So I have got used to that. So most of the people in psychoanalytic community are on the extreme left. I am on the extreme right. So most of the times I get kicked out. It is very Western Judo-Christian in its orientation, that is true. And this is where I feel a movement is necessary to bring in the Eastern tradition, Eastern psychology, Tantra, Yoga, and so on. And we'll take a look at it. How can we combine the Eastern model of the mind with these theories of Freud, Klein, and so on? How can we combo the two? Some people say it is addictive. That once you get into psychoanalysis, you can't get out. It is addictive, like an addictive drug. And there is some truth to it. That if we don't manage it judiciously and honestly, it can easily be addictive in the sense the narcissistic gratification we get, because the therapist is always in a holding position. He does not attack us or criticize us. That safe space and the positive space that we get can become addictive. I know of people who used to go to therapy 5 days a week. And this is how classical psychoanalytic therapy used to be, 5 days a week. So in our training, we were supposed to go 5 days a week for 2 years. Minimum was 3 days a week for 2 years. And some of my friends who were in my batch, they used to go 5 days a week, and on top of it, they would ask for extra sessions. And obviously, it creates a very strong financial bill, right? Because psychoanalysis as such is costly, and when you multiply this by 5 days a week, it becomes quite an amount. Some critics, like the French philosopher Sartre, he used to criticize psychoanalysis by saying it is dealing with illusion of worlds behind the scenes. So Sartre, Karl Popper, and many other intellectuals were against psychoanalysis. And Sartre used to criticize it by saying it deals with illusion of worlds behind the scene. Can you recollect Sartre in some other context also?
I think he used to go to listen Lacanian seminars, right?
Yes. Sartre, there was a group of French intellectuals at that point, and they used to get together. People from structuralism, linguistics, psychoanalysis, philosophy, and so on. And Sartre's book had become very famous, Being and Nothingness and Nausea, 2 books. One was titled Nausea, and second was Being and Nothingness, and they became very popular. So, but he was a critique of psychoanalysis. He used to use a famous statement, which I used to counter that statement with what Kohut said. And Sartre used to say, the other is the hell. That the other is the cause of my suffering. The other does not do as I want him to do. The other is not what I want him to be. So the other is the hell. Right? And the word other is quite extensive in its meaning. It starts with the first meaning of the other person, and then goes on to include even the laws of nature. That the laws of nature are not what I would like them to be. I would not like to have a life only of 75 years. I would not like to have a youth only of 20 years. I would not like to have laws of nature as they are. I would not like to have the society as it is. So all these are included in the word other. And the other does not obey my desire. So the other of Sartre is very different from the other of Lacan. For Lacan, the person in the childhood near to you is the other, and society and everything else is the big other. Right? So Lacan divides the other into two, the small other and the big other. For Sartre uses the word only the other. And there are many people today who are theorizing on the otherness of the other. What is it that constitutes the otherness of the other? So, but we see in psychoanalysis that the other is not always the hell. We see contrary phenomena also. That when the other is not there and we are lonely, then at times it is the hell. And when the other comes, we suddenly feel good. So the Kohut says, opposite of Sartre, Kohut says, the other is the sunshine. So both the things are correct. In some cases, the other is the hell, and we want to be distant from the other and get done with it. And in some cases, the other is the sunshine and we want the other. So both are true in different situations. When we are talking of loneliness and abandonment, we want the other to end our state of suffering from loneliness and abandonment. And when we are in the presence of a bad object, a hurting object, we want to get rid of that, and the other is the hell is true in that context. Any questions?
No, sir.
Okay, how do you go forward in this area if you want to go? Many ways of doing it. In USA, people would typically do MD psychiatry and then do psychoanalysis. Some people would do masters in psychology and then do psychoanalysis. Some would do master in social work and then do psychoanalysis. Usually it is 3 to 5 years of training. And there is International Psychoanalytic Society. If you want to do it officially and be a internationally recognized psychoanalyst, so then you have to do it from IPS. And this training has 3 parts. We call it tripod training. So it has 3 parts. Conceptual learning, your own therapy, it's called training analysis, which means your own therapy for 2 years, and you see patients under supervision. You do therapy to others under supervision. So usually it is 2 years of your own training analysis minimum, and different institutes have different requirements. Some say 100 cases, 100 hours of supervision, some say 250 hours, and so on. So the training is three components: the conceptual training, your own therapy, and you see patients under supervision. 3 components. So it is conceptual training, your own training analysis or therapy, and supervision. Usually it takes 3 to 5 years, right, to really get a grip on it. And it depends upon which school you like. So in India, if you are there, the Freudian school you can find in Ahmedabad and Kolkata. If you are interested in the Kleinian school, it is Bombay. Jungian, there used to be a few people in Bangalore. I am not sure if they are, but Ahmedabad now has a Jung center. So you can go to the Jungian center at Ahmedabad. And if you want to do a formal degree, like a postgraduate diploma or something, then Delhi, I think Ambedkar University does it. But this is the first time it has come in the university system. Usually it used to be outside of the university system. So it was not a part of MA psychology, clinical psychology. There would be some coverage, but details were always out, elaborate programs were out. And today, because of the law, you have to get RCI recognition also. So this is how the academic situation is, and how we will proceed is this. We will first have some conceptual discussions, because till now we were only doing the outline perspective. From next time we will start the real conceptual discussions of Sigmund Freud. So first we will discuss some concepts. Once the concepts are clear, we will have readings in original. We will read Freud exactly as he wrote. Then we will have some papers. Then we will have some case studies. And then we will have non-clinical applications, creative applications. How can you apply the concept to mythology, to literature, to films, to music? So let us take an example. For example, let us take one example. Idealization, de-idealization. Very common event in the human mind that we all use it in some context or the other. We idealize somebody, we de-idealize somebody. At times, we idealize ourselves and we de-idealize somebody else and we look down upon him. Or we do the reverse. We idealize the other, de-idealize ourselves, and we look down upon ourselves and we look up to the other. Okay. Now, this can also be dealt with in a pathological context in therapy, but you can also see this in an artistic concept, in the artistic context. Take for example songs, either romantic songs of the 70s or 60s or devotional songs sung in praise of God. In devotional songs, you idealize God and de-idealize yourself, very common. In many of the songs, Bollywood songs also, the person idealizes the other and de-idealizes oneself. Take a song, for example, there is a very old song, it says, everyone understands Hindi, I believe. Okay. It says, तुम गगन के चंद्रमा हो, मैं धरा की धूल हूं. तुम प्रणय के देवता हो, मैं समर्पित फूल हूं. So you can see the idealization of the other and de-idealization of oneself. And that is used as something creative in poetry. It is not seen as pathological. Similarly, we can have manifestation of narcissism. We can also have expression of a particular mood in a poetry or song or a ghazal. We can engage with all these creative ideas in interpretation of art or in just trying to create a creative treatment plan for somebody. So that will be the creative discourse when the top four are in place. Once concept is clear, readings in original are done, cases are discussed, and then we go to creative application of the area, both in the clinical and non-clinical context. This is how we will proceed slowly and gradually. First we will do Freud, then we will do Klein, then we will take a small detour into beyond, then we will go to Jung, then Kohut, Winnicott, then Kohut, Dawadlu. Then into Indian psychology, Indian psychological models. Okay. And in between, we will be doing some dream analysis, some film analysis, some music analysis, and so on to keep it interesting and juicy. Otherwise, it becomes too difficult and dry and boring. So I'm thinking of that. Once,
Sir, have you tried to mix psychoanalysis with Western and Indian? Have you tried this
yes, I have.
in your practice?
Yeah, it's an area of my interest. I do it quite commonly.
So have you published your work also? Have you written something, or have you your research also, have you done on it?
I have not published in a journal, but there are certain presentations and videos of mine. I can list them out. One is Sigmund Freud and Indian spirituality, where I go into the point what concepts are in Freud and not in Indian spirituality, what concepts are in Indian spirituality and not in Freud, what concepts are present in both, okay? And how can you put them together? That is one. Second is psychoanalysis and spirituality in general. So there is a small write-up on this, psychoanalysis and spirituality. And there is one which is on holistic healing. That how can we use Western psychotherapy approaches, Eastern spirituality, and issues like things like Reiki, pranic healing, and so on, into a framework of holistic healing.
Okay.
So these videos, blogs, writing small articles, they are there. And in my practice, of course, I use all of them. Like, for example, if I have found combination of psychotherapy and homeopathy to be a very good combination. And many people who could not pay,
Okay.
over a period of time, they got stabilized on homeopathy and they could give up psychotherapy. And the same is true in some cases with allopathy and psychotherapy also. Similarly, one of my ex students, she is doing a very good combo of psychoanalysis and psychodrama. Psychoanalysis, psychodrama, and meditation.
Are you
So
talking
what
about
is the
Bhavna ji?
psychodrama? I have heard about it, but I don't know about it. Psychodrama, what is it?
See, what they do is they create a dramatic situation on the, for example, I want you to bring out your feelings towards your father. Right? Now, one way is in therapy, I ask you through an event. Second way is we create a dramatic situation where one person acts as your father, another as your brother, third as your friend, and fourth is you. And you encounter the father and the script is written. So you actually enact out the scene so that the emotions come out. It's like concretizing the whole situation. Or if I want to tell you something about ego and superego, we can have three people playing the role of ego and superego. Right? So you concretize the whole situation in the real world. You dramatize it and then allow the feelings to come up. So you create that, you address the traumatic situation by creating a near about situation, and a lot of thinking goes into how to create that drama for a particular problem. So psychodrama is also one creative way of looking at it, and many people in psychodrama use the fundamental concepts of psychoanalysis.
Okay.
Because once you know the fundamental concepts, you can use it in a variety of ways. So it concretizes and externalizes the whole inner situation. So what is inside, in an elusive way, it is concretized and externalized. So this is the core about psychodrama, that you concretize and externalize a situation so that it becomes very vivid and you participate in it in a very conscious way. But it takes a lot of...
Is there a particular study for psychodrama? Do we have to study this?
Yeah, it is a 3 to 4 year course. So first you learn something which is just the basics, and then the second level is of assistant director, script writer, assistant director, and director. They use these words.
Yeah.
Just as you have graduation, post-graduation, that kind of stuff, they use these words. I don't know what they call the beginner, but they have something like script writer, assistant director, director, something of that sort. So it's a very structured course, I believe 3 years.
Okay.
But if you are interested, there is one person in Ahmedabad who runs this course. It is.
So do we get something to hold, like a certificate or a degree? It is there.
Yeah, it is there. They are in the collaboration with some institute in Australia, but from a legal standpoint, it has no value, because legally speaking, you need an MA clinical psychology from established, recognized institute.
Okay.
So, any questions? Okay, then.
No, sir.
If there are no questions, can we stop for the day and start next time with Sigmund Freud? And that will be the real starting, because we were just trying to lay the foundation today. So we'll start with Sigmund Freud from next time. I think it will be more interesting and juicy for all of you.
And sir, later on, can we bring current cases for the supervision?
Yeah, please. Yeah, most welcome. If any of you are seeing patients, please bring the cases. You can bring cases, you can bring your own situation also if you feel safe, or you can camouflage the situation for confidentiality and then put it up. You don't have to own up your problem as your problem. You can just put it up for discussion. But I always say there is nothing like an innocent interest in psychoanalysis. So the moment somebody says I'm interested in psychoanalysis, it has to give rise to healthy suspicion. Right? So there is nothing to fear about it. If anyone wants to discuss their problems, most welcome. If they don't feel comfortable, they can discuss with me individually, or they can camouflage the problem by not owning it up, giving it somebody else's name and put it up. Doesn't matter. Okay. And if you are seeing patients, you can always bring up cases for supervision, maintaining the confidentiality. So let's stop for the day and see you next time.
Thank you. Bye.
Thank you. Thank you, sir.
Thank you, sir. Thank you.